Seasonal depression, also known as seasonal affective disorder or SAD, is a type of depression that only occurs during the fall and winter seasons. It's characterized by sadness, a lack of energy, and difficulty participating in normal activities. While it is more common in young adults and women, SAD can affect anyone. SAD is caused by a combination of factors, including changes in daylight duration, chemical imbalances in the brain, and hormonal imbalances. Light therapy, talk therapy, and antidepressants are commonly used to treat it. Self-care strategies, such as getting outside and exercising regularly, can also help with SAD symptoms. If you're experiencing SAD symptoms, it is critical that you seek help, because it can have significant impact on your daily life and overall well-being. As many as 10 to 20% of people in the US may have a mild form of the winter blues. So what are the causes of SAD and who is at risk? Well, seasonal affective disorder can affect anyone, but certain factors may increase the likelihood of developing the condition. These are some examples. Age. SAD is more common in young adults and usually begins in their late teens or early 20s. Gender. SAD affects women more than men. Family history. If you have a family history of SAD or other types of depression, you may be more likely to develop SAD yourself. High altitudes. SAD is more common in people who live in high altitudes, such as the extreme northern or southern hemispheres. This could be due to the shorter days and longer nights at these altitudes, which can result in a lack of sunlight during the winter. Cloudy weather. People who live in areas with a lot of clouds or overcast skies are more likely to develop SAD due to a lack of sunlight. A history of other mood disorders, such as major depressive disorder or bipolar disorder, may increase your risk of developing SAD. A shift in the biological clock caused by a lack of sunlight. Serotonin and melatonin levels in the brain are out of balance. Hormone imbalances, including low vitamin D levels. So what are the symptoms of seasonal depression? Sadness, anxiety, cravings for carbohydrates, and fatigue. Hopelessness, difficulty concentrating, and irritability. Heavy limbs, loss of interest in activities, oversleeping, and at the extreme, suicidal or thoughts of death. So now we understand what it is. What are the symptoms? Let's look at the treatments for seasonal affective disorder. Light therapy, also known as phototherapy, involves exposing the eyes to a bright light through the use of a light box or other special light source. It's thought to aid in the regulation of the body's internal clock and the balance of the brain chemicals such as serotonin and melatonin. Light therapy is typically administered in the morning and may be used in conjunction with other treatments such as medication or talk therapy. Talk therapy, such as cognitive behavioral therapy and other types of talk therapy, can be effective in treating SAD. CBT entails working with a therapist to identify and replace the negative thoughts and behaviors with more positive ones. Other types of talk therapy, such as interpersonal therapy, can help people better understand and manage their relationships, as well as how they affect their mood. Self-care strategies. In addition to professional treatment, a variety of self-care strategies can help manage SAD symptoms. These may include going outside and exposing yourself to natural light, even on cloudy days, and engaging in physical activity and exercise, which can help improve mood and reduce stress. Adopting healthy habits, such as getting enough sleep, eating a well-balanced diet, and dealing effectively with stress. Seeking social support from family, friends, or a support group. To determine the best treatment plan for your specific needs and circumstances, consult with a medical health professional. It's also critical to remember that seeking assistance and treatment is a sign of strength and not weakness.